We'll call this meeting to order, the Black Hawk County Board of Supervisors for December 20th, 2022. Grant, he said he wasn't going to be here. He'd call in later, but I doubt if he makes it.
Okay.
Roll call vote, please, Mr. Reader.
Leyland.
Here.
Little. Schwartz.
Here.
Trelka.
Here.
White.
Here, have a moment of silence to reflect on our actions for the day. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Have the agenda received as proposed or as amended?
So moved.
Second.
Moved and seconded. Any discussion? Hearing none, all in favor, aye.
Aye.
Opposed, motion carried. Public comments. Anyone from the public? Don't see any public out there. How about on?
Hi, Katrina. This is Debbie with Black Hawk County Board of Supervisors. And we received a mailing yesterday. I think it came from Nationwide, but it's
She talking to us.
I bet not. No, she's gonna be
Your timing was impeccable.
Yeah. Okay, we're ready.
Good comments, Deb. Claims and payments.
Oh my gosh. Good morning, everyone. So our total bill payments today are $1,108,310.64. That is larger than usual, so I will point out we are paying for the purchase of 2 road graders from Murphy Tractor for one is $378,000 and one is $380,000. And then we are paying $3,071.20 from the Sheriff's 60/40 fund today.
Thank you.
Everything appears to be in order.
Motion to approve.
Second.
Moved and seconded. Any discussion on any of the items? Hearing none, this resolution, please answer as your name is called. Someone needs to shut off their microphone
There.
online, please.
Leyland.
Yes.
Schwartz.
Yes.
Trelka.
Yes.
White.
Yes, resolution adopted. Next is.
Yes.
Little.
Yes, yes.
Thank you.
Next is receive project updates from elected officials. Not everyone at once.
Kathy usually jumps.
Morning, Board. Ryan Brennan, the assistant
Ryan.
engineer.
Morning.
We do have plows out today, just kind of cleaning up some of the blowing snow from last night. Obviously, we are watching some weather for later this week, so we'll just plan on getting things ready and seeing what we have to deal with. So definitely be some blowing snow and some other things to deal with. So
Any questions? Thank you.
yep.
Thanks.
Just a reminder, we have our compensation committee meeting at 10 a.m. So with the consultants, Linda and Dan, you can come downstairs to that conference room. It will be virtual, so if you can't attend in person, then you can also join on Microsoft Teams. So, and same for Michelle and Mike Hendrickson and Grant. So, thanks.
Thank you.
Rita Schmidt, treasurer. Last time I get to say that. It's been 47 years, and I've enjoyed every one. And I want to thank everyone here in the board, all the support that I have gotten from the Board of Supervisors. And I told I wasn't going to cry, but if you know me, I'm a crier. But just the support from the board, from all the offices, Grants and TJs, Sandys, everybody has given support to our office when needed and when we reached out to them. And the same if they reached out to us. So it's been a wonderful ride. Retirement's supposed to be exciting, and I'm trying to get more excited about that as I leave. But it's I can't thank you guys enough for the support and the direction that you have given us over the years, so thank you.
for a great job, Rita.
Thank you.
Thanks, Rita.
Any other department heads? Let's see, Yolanda on. Moving on to minutes approved for December 13th.
So moved.
Second.
Moving to second, any discussion? Hearing none, all in favor, aye.
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 Opposed, motion carried. Consent agenda by resolution.
So moved. Second.
Moved in second, any discussion? Hearing none, this resolution, please answer as your name is called.
Little,
Yes.
Schwartz,
Yes.
Trelka,
Yes.
Leyland,
Yes.
White.
Yes, resolution adopted. Next is other business. This is a resolution that Beth Van Langen, Financial Management Supervisor, Scott Brown, Motor Vehicle and Operations Manager, and Ashley Bass, Property Tax Supervisor, be authorized to conduct investment and general office transactions in the absence of the Blackhawk County Treasurer, Linda Hinsman, effective January 2nd, 2023.
So moved.
Second.
Moved and seconded. Any discussion on this? Hearing none, this resolution, please answer as your name is called.
Schwartz,
Yes.
Trelka,
Yes.
Leyland,
Yes.
Little,
Yes.
White.
Yes, resolution adopted. Next, a resolution to approve the submission of Health Department space proposal to Baker Tilly for evaluation as a possible American Rescue Plan funded project.
So moved.
Second.
Moved and seconded. Any discussion on this item? Mike, anything you want to say about this?
Only to say that, number one, we're going to have some handouts here I'm going to be passing out. But number two, the most important thing to keep in mind is that this is just an opportunity to, or this is just a vote to get the ball rolling with our consultant to have them evaluated. This isn't to approve the project at this stage.
Right.
Do you want us to wait till we have the handouts, or are you prepared to just?
I can go.
This is of, is this of the presentation?
Thank you. Thank you.
Thank you. So if we're not voting on this for approval, I guess this material we can read on our own time, unless you want to talk about something that's, I don't think it'll change the vote.
Yeah,
No, it's just the presentation,
Yeah.
I think, for telling us what they proposed.
I've got a question for you before you get started. We've got a department that has a person that called in sick for COVID. Shouldn't the rest of the people in that department be tested? Would that be wise?
Sure. So Caitlin Emmerich, Interim Director for Health Department. The guidelines for COVID exposures changed, I think, over the summer or early fall. So the current guidelines from CDC are that anyone that's been exposed to COVID, they're recommended to mask. They're not recommended to
Oh, okay.
isolate.
All right, thank you.
And I can send that over if you'd like or something, but yep. So first, I apologize, my font in my slides didn't transition, so if there's a little bit running off the slides, I'm kind of anticipating that, given that it doesn't look the way that it's supposed to look, but I just wanted to share very briefly a little bit about the proposal that you have likely seen for the eligibility questionnaire that is requested to go to Baker Tilly for assessment. There are 4 identified needs in the eligibility questionnaire. First of all is the Public Health Center Clinic, which I want to speak to a little bit. Second is office space for health department staff. Third is building infrastructure. And fourth is storage. These 4 topics are reflected in the survey that staff took in December of 2021 about their space needs in the Pinecrest building. And I highly encourage that the results of that survey be considered throughout the consideration of this proposal. In addition to internal feedback from staff, we also have received external feedback. So Blackhawk County Health Department was accredited in March of 2022, so we're early into our accreditation. Our site visit report, which is the official report from the Public Health Accreditation Board, recognized our space as not being conducive to meeting the needs of our department and our customers. This is a quote from the site visit report that speaks to Black Hawk County Public Health is housed in an older building, which makes ADA or American Disabilities Act compliant difficult. In some of the instances, we're aware of that. We discussed it in our site visit report. And their recommendation was for us to work on that as part of our accreditation. Oh, wasn't expecting that. Okay. So in a previous meeting that I wasn't here, the board discussed the services of the public health clinic a little bit, and I just wanted to clarify some of those services, if I may. So our clinic provides direct services in the areas of sexually transmitted infection testing and counseling, well child exams for Title V eligible children, oral health screenings and fluoride application, blood lead testing, tuberculosis screening, and we provide immunizations. Currently, our clinic is open Monday through Thursday for a block of time in the morning, 8:30 to 11:30, and then in the afternoon from 1 to 4. And we do accept appointments and walk-ins. Our clinic hours have been slightly impacted by our staffing. We still have 2 open nursing positions, so we've had to adjust accordingly, but those are our regular hours. I think we're primarily known for our sexual health services. We provide direct health services through STD exams, all-site testing for some common sexually transmitted infections, which I should add, not all providers that test for STIs provide all-site testing, but it is a best practice that we're currently doing. Testing for trichomoniasis and bacterial vaginosis, also rapid testing for HIV, Hep C, and syphilis. We provide adult hepatitis A and B immunizations and provide safe sex counseling as well as on-site treatment. Additionally, we provide preventive services with sexually transmitted infections, HIV prevention counseling and partner services, pre-exposure prophylaxis to prevent HIV infection, post-exposure prophylaxis for those that have been exposed to HIV or potentially been exposed to HIV. We also provide free condoms to anyone that comes and requests them, and educational brochures for our clients. And we also collaborate closely with our disease surveillance and investigation team for outreach testing services. Speak to our outreach testing in just a second. In terms of our encounters for FY22 and then the, oops, I'm sorry. This is a very little screen now. In terms of our encounters for FY22, we saw 1,171 individuals in our clinic in FY22. I just want to point out in August of 2022, we had a little increase of clients. We did do some targeted outreach and really encourage people to come and visit the clinic that week due to kind of some incentive testing that we had. So of the 137 encounters in the Public Health Center that during that period of time, 108 of them did receive incentive for coming into the clinic. And then in terms of all of our encounters for the services that we provide, most of our services are provided in the clinic, but we also provide testing at the jail with our child adolescent health program and outreach settings. And then we also do go to Bremer County Public Health. That's through a grant requirement that we have to serve a service area, and Bremer County is one of the counties in our service area. The outreach that we commonly provide are through the ASAP clinic. We did some testing at Pride Fest this year. We worked with the VA on their Operation Winter Shield, and then provide other outreach testing. We, as I mentioned, we also provide child and adolescent health services. This is through our designation as a Title V screening center for through our Child and Adolescent Health Grant. So that includes a full health screening, well child visit, head to toe exam, includes that vision and hearing testing, developmental screening, depression screening, blood lead screening, and offering immunizations, among other things. We are also a Vaccine for Children program provider that is kind of in conjunction with our Child and Adolescent Health Program to provide the VFC vaccines. There are certain eligibility criteria to receive the VFCs, or excuse me, to receive vaccines through the Vaccine for Children program. But it is a federally funded program that we participate in, and through that, make sure we enter all of our vaccines that we give in the statewide immunization registry. And then finally, which links back to our eligibility questionnaire and our COVID services and future pandemic planning, immunization services is the last component of the services we provide in the clinic. Like I mentioned, it includes childhood immunizations and adult immunizations. Currently, we're also offering monkeypox immunizations and continue to offer COVID-19 vaccinations on an ongoing basis. Are there any questions for me about the services that we offer or kind of the volume of clients that we see?
Are those COVID, I know that was one of those immunizations, are those done by appointment, or people can walk in for those, or?
Typically, we offer them on Fridays. We try to kind of group them. So we offer our appointments on Fridays, but if somebody came in, walked in and wanted one, we wouldn't turn them away.
Is that for the others as well, probably other? Okay.
Typically.
COVID just always catches my eye, but
Yeah.
I thought, yeah, I wondered about those, thank you.
Any other questions? Thank you.
Thank you.
Thanks very much.
I have a resolution on the floor. Please answer as your name is called.
Trelka,
Yes.
Leyland,
Yes.
Little, Schwartz,
Yes.
White,
Yes. Resolution adopted. Next, the resolution that the letter of support for Pillar of Cedar Valley to add an additional 14 ICF ID beds to the facility to be approved, and direct the chair to sign for same.
So moved.
Second.
Moved and seconded. Any discussion on this item?
Good
Yes.
morning. Thank you for having us. My name is Hillary Ahrens. I'm the administrator at Pillar of Cedar Valley. This is Kelly Rakuzik. She's our marketing director. For those of you that were here last year, this is the same proposal. We're requesting 14 additional beds, a new expansion and renovations. The reason we're back is we did not do those expansions last year due to several reasons, but right now we'd like to do the expansions all together throughout the facility. So Kelly has a letter from our COO that she will read you, and then if you have any questions, we'd be happy to answer.
Thank you for your ongoing support of Pillar of Cedar Valley. We are genuinely appreciative to all of you for your unwavering support of our mission. We are committed to serving Blackhawk County and the surrounding regions by providing quality services to clients with behavioral health needs and skilled nursing services. Pillar of Cedar Valley has 114 skilled nursing beds, 41 beds for persons with persistent mental illness, and 45 beds for persons with intellectual disabilities. We are requesting the support of County Social Services for the 14-bed expansion of our ICFID unit. Currently, Pillar of Cedar Valley is fully occupied with a waiting list of 27 people. Our ICFID beds consistently operate at full capacity, and we frequently must turn away prospective residents due to lack of capacity. This project will help us to fill a critical need in the community. Pillar has approximately 5,500 square feet of unfinished space in the lower level that will be converted to resident rooms, common areas, and office space. I would like to share a little bit about the residents in our ICFID facility. Although many of our ICFID residents have co-occurring mental health diagnosis to be considered for admission into our ICFID unit, an individual must have an intellectual disability as primary diagnosis. Intellectual disabilities include autism, Down syndrome, but many individuals have other diagnoses, including mental health diagnosis. Individuals must have an IQ below 72 to qualify for the ICFID level of services, and all residents in the ICFID have Medicaid benefits. Thank you for the generous time that you are giving to review our request. We are available to answer any questions that the council may have.
Any questions?
No, I see you forwarded something, I guess, to go to the group.
That was last year too.
But I just thought all the expansion plans and things too, so that's.
So, one of my questions would be, do you have enough staff to cover these people, to take care of them properly?
Currently, with the amount of ICF beds that we have, yes. And then once we would add the 14 beds, we would hire and ensure that we have the adequate staffing to meet the regulations required. So we would not put any residents into the facility until we knew we had the staff.
Until you had people hired? Because there's a shortage of help all around the community for nursing homes and stuff, so I wonder how you guys are gonna manage to do this.
The unique thing about the ICF ID unit is you do not have to be a certified CNA to work in that unit. So finding care workers is a little bit easier, similar to what you would find at EPI. We just need direct support professionals to work in that unit.
Thank you.
What's the timeline for this? The application will be submitted immediately, I suppose, and then you find out approximately when?
Right, and then I can let you know that because we don't know the time frame right now.
Okay, well, no, you don't have to let me know. I just was curious of how immediate that was, so that you can move forward. Thank you.
Thank you very much for you guys' report. Any further questions?
No, I'll just add that I'm going to have to vote no on this today. I've had just too many people reach out to me throughout this year and last year with concerns about conditions there, and I think a lot under your previous director there were some deaths that should have been prevented, and I just can't support this company.
Any further comments? Hearing none, this resolution, please answer as your name is called.
Leyland,
Yes.
Schwartz,
No.
Trelka,
Yes.
White.
Yes. Resolution adopted. Any reports or information from the board?
Yes.
Sir,
We have a plaque for you.
I don't need a plaque. I told you that.
We need to give it to you.
It's going to be in grateful appreciation of your service as board chair of the Blackhawk County Board of Supervisors 2022. So, thank you, Mr. White.
Gets it anyway, yeah.
We're going to...
I'll entertain a motion for adjournment.
So moved.
Second.
All in favor, aye?
Aye.
Aye.
We are adjourned.